Hey everyone, it's Rena Jadov with the Live Longer podcast and Health Bootcamps. And this is the beginning of our multi-part series on the autoimmune fix. And here is the amazing world-leading Dr. Tom O'Brien. Welcome, Tom.
Thank you so much. It's really a pleasure to be with you. Thank you.
This is truly an honor. And for everyone out there that's listening, my God, you are in for a treat. Dr. Tom is such a fountain of wisdom, brilliant insights, and true understanding of health that you are truly in amazing hands over the next 4 to 5 series. So make sure you watch every single one of those. Okay, let's get started. So this is part 1, and today we're going to talk about what the heck is an autoimmune disease anyway, and what are all the different names it goes by. Dr. Tom, what's autoimmune?
The word autoimmune means that your immune system is attacking your own tissue, like your thyroid or your brain or your bones or your muscles. And it's always been considered to be a mistake of the immune system or the immune system gone wild, but we now know that's not true. Mrs. Patient, your immune system is the armed forces in your body. It's there to protect you. There's an Army, a Navy, an Air Force, a Marines, a Coast Guard, IgA, IgG, IgE, IgM, all these technical parts of the immune system. They're all there to protect you. So when you understand that the immune system is protecting you, when it gets activated, the question is, what's it trying to protect you from?
So true.
So when you go see a doctor and you've got symptoms, and let's say that you're diagnosed with diabetes or with Hashimoto's thyroid disease, it's like you've fallen over a waterfall into the pond below, and you swim up to the surface and you get the water out and you're trying to stay afloat in this pond of diabetes or this pond of recurrent miscarriages or this pond of Hashimoto's thyroid. You're trying to stay afloat in the midst of all these symptoms. So everybody's looking for the life jacket so they can stay afloat because the water is so turbulent, because the waterfall keeps falling into the water. You're still living the life that created the problems you've got. And you're in this turbulent pond and the waterfall keeps coming in.
Wow. So
you want a life jacket with the least side effects possible. So a natural approach at first, if you can, you always try a natural approach. If it doesn't work, you take the drugs. Don't be silly about this. You take the drugs so that you can stay afloat in the pond. But then you swim over to the side of the pond. You get out of the water. You walk up the hill. You walk back upriver and find out what fell in the river that carried you downstream and eventually took you over the waterfall into the pond below.
Right.
That's called functional medicine. And I'm on the faculty of the Institute for Functional Medicine, and we teach doctors how to do this, how to go back upstream. It's called going upstream to figure out what happened to this person. And I'd like to give you just one example, if I can.
Yes.
Let's say a woman comes in her early 30s and she's got lots of gut symptoms and she's diagnosed with an autoimmune disease like colitis. And colitis is an inflammation, an itis of your colon, like bursitis. Conjunctivitis is an inflammation in the eye. Arthritis is an inflammation in your joints. Colitis is an inflammation of your colon. So she comes in and she's fallen into the pond of colitis with lots of gut symptoms. And they do the test and the doctor says, oh, you've got colitis. And you're going to take this drug, or we have to do some surgery. So you try for the life jacket with the least effects possible. But when you go back upstream, you have to go back and you take a look. And this is true for any health condition. You go back and in the questionnaires, if you do the right kind of questionnaires, how was your mother's pregnancy with you? Was she on any medications? How was childbirth? Were you born by natural childbirth or by cesarean section? Because, here's an example. We know in the last month of pregnancy, Mom's reproductive tract, the vaginal tract, the bacteria in the vaginal tract completely change, and there's a whole lot of a bacteria called Prevotella, which is really hard to even find any other time in the reproductive tract. But in the last month of pregnancy, it's dominant. There's a whole lot of it. Why? Because Prevotella carries the DNA messages of the mammal that's going to be feeding that baby. So when baby is born by natural childbirth and comes down the canal, baby is smothered in Prevotella and other good bacteria in the eyes, in the nose, in the mouth, in the ears, you know, all of the film that babies come out covered with. That's all really good bacteria. And that bacteria gets into baby's digestive tract and migrates down and says, okay, and it turns on the genes that says, okay, baby, here's the formula of the milk from the mammal that's going to be feeding you. So let's get these cells starting to make these digestive enzymes.
Oh, wow.
And let's get these cells over here ready to go. Now, every baby at birth, it has severe intestinal permeability. It's normal to have intestinal permeability at birth because when they're inside the womb, they're swimming in this soup of mom's amniotic fluid. You know, it's just all this soup. So there's no borders. I mean, from the mouth and the gut, it goes into the bloodstream, everything. But at birth, that natural childbirth, the bacteria will give the message to turn the genes on in the baby's gut that says, close down those tight junctions now. You don't need to have a leaky gut anymore. It's time to have a normal gut because food's going to start coming down in a few months. First, here's the recipe for mom's milk that's coming so you can digest the milk, but let's close those tight junctions. No more intestinal permeability here. So when baby is born by C-section and doesn't get that, what so many obstetricians know now, because there have been many, many studies on this over the years, the obstetricians will take a sponge and kind of insert a sponge in the reproductive tract so that if baby has to be born by C-section for some reason, the obstetrician then takes a sponge and just smothers baby with the sponge to give baby as much of that good bacteria as possible. So that's one of the questions for the 34-year-old woman that's come in. How was your birth? Was it a natural childbirth? Was it a cesarean section? Did you have any antibiotics in the early part of life? And you find so many kids that had recurrent ear infections and they've had multiple doses of antibiotics, which alters the gut of the microbiome. The good bacteria gut completely gets altered. So that baby then, after birth, is colicky. If baby was born by C-section, they're much more likely to be colicky and just crying in pain, crying when they're fed. And then they're much more vulnerable to ear infections and asthma and in the early teenage years, acne. And then they get constipation, which progresses through their late teenage years. And if it's a woman, menstrual irregularities, their cycles are not regular because the microbiome is so out of balance, has been for years. And then they go into their 20s, they've got severe menstrual cramps with their cycles. And the cycles,
you are literally describing my life.
This is a mechanism that's so very, very common. And then they come to you at 34 and they've been diagnosed with colitis. Am I going to treat the colitis? You know, of course you want to give the safest life jacket possible so a person can function, calm down the inflammation as much as you can, but you have to change the environment that this body has developed from. You have to rebuild the microbiome, help build stronger thyroids or adrenals or whatever tissue didn't have a chance to develop properly.
Oh my goodness. You, I think, just answered the question dominant in most people's minds when they fall sick, which is why me?
Exactly. You just have to go back upstream and you almost always can find out what it is.
And it's literally all the way to birth, huh?
Yeah, even before. We now know that it's generations. It goes back generations sometimes. And that the DNA in the microbiome gets passed on by the mother to the baby. And mother carries forward from generations beforehand some of the health problems that grandparents and great-grandparents had.
Let's take a look at what are all the different autoimmune diseases today. So for those of our listeners that are trying to understand, is this series something that I want to keep watching? You mentioned diabetes, you mentioned colitis.
Yes.
Go ahead and give us the list of the dominant.
Sure. There's over 80 of them now that we know for sure. Multiple sclerosis, rheumatoid arthritis, lupus, which is systemic lupus erythematosus, scleroderma, psoriasis, Alzheimer's is autoimmune, Parkinson's is autoimmune, cardiovascular disease begins as an autoimmune mechanism. There's over 80 of them now, so there's no tissue in the body that may not have an autoimmune mechanism going on. Hepatitis is autoimmune.
What about cancer? Is cancer autoimmune too?
Cancer has an autoimmune contribution to it. There's more going on in cancer than just the immune system attacking self, but there is that component to it there also.
I think it might be easier for you just to tell us what is excluded from the autoimmune list at this point. Like what's not autoimmune?
Oh my goodness. Let's see. Happiness. There's no
it'd be nice if happiness was autoimmune, because then we could all just, be infected with happiness. How wonderful.
There you go. Wouldn't that be great? That would be great. No, but actually happiness is something that you have to develop, like a nice garden, a beautiful garden.
Yes.
You slowly have to make room for the beautiful plants to grow and flower and the weeds not to grow so much.
Oh, so true. So in terms of just helping people understand, yes, there is autoimmune. It's probably coming from something that happened way back when. What else are the symptoms? You talk about spectrum in your book, Autoimmune Fix. So for someone who hasn't yet been diagnosed, what are some of the symptoms that may be giving an early indication of something more serious brewing down the road? Because as we know, disease doesn't happen overnight. You don't get cancer overnight, or you don't get MS overnight. Colitis isn't overnight. It's taking years. So how do you know what those symptoms are so you can take the right steps to prevent getting a colitis or getting MS?
It's really a good question. And unfortunately, there's no simple answer. What's happened is that we have grown up in a society, and we believe it's our birthright that some other person is in charge of our health. We go see them when we're sick. You never see them when you're well, right? We treat our cars better than we treat our bodies because there's an owner's manual for the car. And so you go in every 5,000 or 10,000 miles, they change the oil, they do whatever they do. When's the last time you went in for a tune-up on your body? Right? But this thing has to run for 80, 90, 100 years, 24/7. There is no machine that's ever been built that can do that. But we expect this body to do that without giving it maintenance. So we have to reframe how we think about our bodies. They're not like addendums that we think about only when they're acting up.
Yes.
That when we start learning how to appreciate how these bodies run and what's good fuel to put in them, and how do you help them to rest when they need to rest, and how do you work them out in a way that encourages stronger tissue, a healthier function. And when you learn these things, your whole life changes. People are just happy, and they're and I'm not talking about being blissfully ignorant about what's going on in life, but they feel happy. They wake up in the mornings and they're ready to go to embrace and tackle whatever it is that they have to tackle. But it takes a while to get there. This is a concept that I want to introduce right now. And it comes from a Tibetan word called, and I'm not sure I'm pronouncing it correctly, but I think it's Maitri, Maitri. And it means loving kindness and an unconditional friendship with oneself. That when your best friend is you treat yourself in a way, better than you hope that somebody else would treat you, because if you don't treat yourself well, how can anyone else treat you well? What does that mean? I just read a paper last week that people that eat French fries and potato chips 3 times or more a week have a 5-fold increased risk of early death compared to people that don't eat French fries and potato chips 3 times or more a week. You know, that when you eat those bad fats, they're just bad for you. Bad means bad. Well, I can have a little. Well, no, you can't. You know, when you eat those bad fats, the remnants of those fats stay in your bloodstream for 57 days.
Oh my God.
That's how long you can find the residue of bad fats in your blood, and your immune system, trying to protect you, has to fight these things that are not supposed to be there.
So you've activated your immune system for 57 days, in essence.
That's right, just to fight the French fries that you ate. I mean, I love French fries. I love truffle-flavored French fries, right? I'm a sucker for those. But if I have them once every 3 months, it's really a treat. It's really a treat. You know, you just don't want to do that very often. Let me give you an example, and then you start thinking about all of the fats that we've eaten in our life that aren't so good for us. 40% of the cell wall of your brain cells, the wall, it's called the membrane, that's the wall around the cell, is made up of fat. 40% of that fat is DHA. That comes from fish. There's 2 major components in the fats of fish, EPA and DHA. The DHA is really good for your brain. When you don't get enough DHA, your body is still going to make new cells. And if you don't have enough of the correct raw material to make the cells, your body will use whatever it can, you know, and you build your house out of straw instead of brick, right? So what does that mean for brain cells? I'm going to date myself here. You know, we used to go to the doctor, and you go in the bathroom to leave a urine sample, and you put the cup on a Lazy Susan in the wall. And the Lazy Susan, it rotates around to the other side of the wall and the nurse is over there, and she runs all the tests on it. That's a Lazy Susan. The way your brain works and the way your nerves work is that they're Lazy Susans in the cell walls, in the membranes of the cells. And one cell makes a chemical that goes through the cell wall, through the Lazy Susan, to the next brain cell. It takes that chemical and it tweaks a little bit, goes to the next brain cell, to the next brain cell. And there's a line, and that line of cells makes your nerves. And they communicate through the Lazy Susans. But if you've made your house out of straw instead of brick, your Lazy Susans are all rusty.
Right.
And they don't turn very easily. You don't communicate very well. That's why the studies show when you take kids with attention deficit hyperactivity disorder and you give them the good fats from fish oils, especially DHA, in 6 months to a year, their IQ goes up.
Really?
It's because their brains are functioning better, because the Lazy Susans have now, they pushed out the bad fats, and you now have good fats in there. Oh, wow. And their IQ goes up. They think better. They're more coordinated, muscular-wise. They're more athletic. And their processing is quicker and more accurate. You see the studies again and again and again like that. So that's just one example of putting the right raw materials in there. And that's true for your skin. It's true for your bones, for your thyroid. So autoimmune diseases are when your immune system says, we've got a problem here. And the immune system is trying to fight something. So where does that come from? Why does your immune system try to protect you and it's attacking your own tissue?
Okay,